of the partnership between the Philippine Nurses Association of America and the Alzheimer's Association. Today, we come together to celebrate a significant collaboration that will greatly benefit our communities. As we all know, the healthcare industry faces many challenges, and one of the most pressing issues is the number of people diagnosed with Alzheimer's disease. This debilitating condition affects millions of individuals and families worldwide, and it is our responsibility to ensure that we provide the best care possible. The Philippine Nurses Association of America and the Alzheimer's Association share a common goal of improving the lives of those affected by this disease. And through this partnership, we aim to increase awareness, educate healthcare professionals, and provide support to families and caregivers. To start our program, I'm calling Dr. Leo Felix Jurado, the PNAA Executive Director, to provide a reflection for today.
Let's center ourselves with and recognize the presence of someone who is higher than us. I know that we are from different belief system, but I know that we also submit ourselves to a deity that's higher than us. So we bow our heads with thanksgiving for giving us this opportunity for this launch of the Alzheimer's Foundation partnership with the Philippine Nurses Association of America. We know that this partnership will blossom, and we hope that we can recognize this disease that can affect all of us. So be with us, and that we will learn from this partnership together. Thank you.
Thank you, Dr. Jurado. And now I'm calling Dr. Gloria Biriones, the president of the Philippine Nurses Association of America, to give her opening remarks.
Greetings from Houston, Texas, and welcome to the launching of the Philippine Nurses Association of America and the Alzheimer's Association partnership. What a beautiful day to start that we are all together with the 52 chapters across the country with over 4,000 members are here to truly support the end of Alzheimer's and other dementia now and beyond. That is our hope through research and many more practice, as well as community and education of the public, healthcare, and caregivers. The mission of the Philippine Nurses Association of America as a professional organization is to uphold and to foster the positive image and welfare of the Filipino American nurses, and to promote professional excellence and contribute significant outcomes to healthcare and society through education, research, and practice. What an exciting time for us to partner with the Alzheimer's Association in leading health equity through diversity, equity, and inclusion, through finding ways to stop Alzheimer's and other forms of dementia, and to provide the quality care and support to those that are affected. So with me tonight, I want you to be excited with the partnership and leadership of Dr. Carl Hill and Eddie Yao and all their staff. So let's just give them a round of applause. Thank you.
And to welcome us with a partnership, I'm calling Dr. Carl Hill, who is the Chief Diversity, Equity, and Inclusion Officer of Alzheimer's Association.
Oh, thanks so much. I am so inspired by those comments. Dr. Barriones, that was amazing and good to see you. Dr. Ramos, we're thrilled. I tell you, we are, Edie Yao and I on the diversity, equity, and inclusion team, we really prioritize partnership as our way of pursuing equity. And I tell you, we just heard the importance of understanding and respecting and valuing differences, right? So we know that there are groups, populations in this country that are understudied, underrepresented, disproportionately affected, that we've got to do more. We have to be intentionally inclusive, and do that. We need to learn how best to deliver our resources to the communities that need us most. And in learning, we value partnership. You know, partnership is so tremendous and promising. We've got a number of partners that we have made over the past 2 years, and working with the Philippine Nurses Association of America just adds to that momentum to be able to for us to get into communities with our resources in the right way, right? And that's the difference between maybe equality and equity, right? Equality is, hey, we're going to try to do something for communities and we hope it works. Equity means we're valuing partnerships, working with the Philippine Nurses Association of America, specifically with Dr. Barriones and Dr. Ramos and all of the wonderful people that are part of this organization. So let's just stop, Edie, and give our new colleagues a hand. We're so excited about working with you. So, you know, the sky is the limit. And I know that we're focusing our first steps on education and awareness. And that's very much needed, knowing about the different dementias. Alzheimer's is the most common cause, but there are other dementias. We're in the age of treatment. You know, if you've been following the news, you know, there are 2 treatments that have been approved by FDA. But unfortunately, the Centers for Medicare and Medicaid Services have decided not to cover those treatments, you know, creating a barrier for people to get access to these treatments, right? So we've got to get this information out to communities so that your membership, your members across the country can work with us as policy advocates or to help us as volunteers to get this education and awareness out to communities. So the sky's the limit. We're gonna start at education and awareness, but I am just thrilled about all the things that we're going to do, some of which I don't even know because we're going to be so creative together. So I am running to catch a flight, but I'm going to leave the Alzheimer's Association's part in this wonderful kickoff meeting with my dear colleague Edie Yao to talk specifically about the collaboration and partnership. But just wanted to end by saying thank you. You know, we don't get here without people wanting to work together. And I really, really appreciate everybody's commitment to our partnership and our step forward and all the things that we will accomplish together. So thank you so much, Dr. Barriones and the entire association. And I look forward to our work Edie, can I pass it over to you?
Yeah, thank you, Dr. Hill. And let me extend my thanks to everyone as well here. I got a chance to meet Dr. Barriones in person in Houston. Thank you for coming to our show Unforgettable there. It's always a joy to meet people in person. And I want to thank our colleagues. We have a few of our colleagues here from our chapters attending. So thank you also for coming. And first and foremost, I want to thank Mary Doyce Ramos, who really brought us together. I was telling the story before how it was attending the Addressing Health Disparities Conference that the Alzheimer's Association put on last June. And in conversation with her, meeting her there and expressing to her our interest in engaging Filipinos more. And she said, well, I organized the education for Philippine Nurses Association of America. And so here we are together now in this formal partnership. So thank you, Mary Doyce, so much. So let me go ahead and share my screen. And I want to just give you some context of where the Alzheimer's Association is coming from in this space. So let me do that. You heard Dr. Hill mention, we're in an era of treatment, and this is a major milestone. We have never had treatments that actually address Alzheimer's specifically. We have other treatments that address the symptoms, but to actually address the amyloid plaque in the brain and to reduce cognitive decline is really significant. Now, we know we have quite a bit of work to do to make sure that those treatments are available and accessible to everyone. But we also know that there are other treatments that are coming down the pipeline, and it's just so critical that we make sure our communities, Asian Americans, are in the know of understanding Alzheimer's and dementia, and that they know the importance of early detection and ultimately have access to whatever is available. So our vision of the Alzheimer's Association is a world without Alzheimer's and all other dementia. It's as simple as that. We want to create a world that is no longer having to deal with Alzheimer's. Our organization was founded in 1982. So we've been around for a little bit. And there are three areas of focus for us in our mission. One is to advance global research. The second one is to drive risk reduction and early detection. And then the third one is to provide quality care and support for those who are living with Alzheimer's. And that's a really important piece because so many families, particularly I hear from many Asian American families that they deal with this in isolation, that they feel like they have to carry this burden, whether it's out of filial piety or they don't know of resources. And we're hoping that in partnership with all of you, that we can assure families that there is help out there in addition to their families, not in place of. Every year, the Alzheimer's Association puts on a facts and figures report. And so we will have one coming out very soon in March. This is last year's, but the figures are still very similar in that we know more than 6 million Americans are living with Alzheimer's. 1 in 3 seniors dies with Alzheimer's or another dementia. And for every person who's living with Alzheimer's, there's likely 2 or more caregivers. And so over 11 million Americans provide unpaid care for people with Alzheimer's or other dementias. The research area is certainly the area that is providing us the hope, right? And led us to the treatments and has led us to understand Alzheimer's and what's happening in the brain. But none of this could happen without our advocacy efforts and with people like you and me and family members who are advocating for more attention to this disease and more funding at the NIH for Alzheimer's research. I think this is really important just to be aware that it is more than just us. It's really creating a movement of people to raise their voice and make sure that there is constant stream of funding for Alzheimer's research. So you can see that in 10 years, from 2013 to this year, the tremendous growth in the annual funding for Alzheimer's and dementia research from $504 million a year to now $3.7 billion in a year, every year at the NIH to focus on Alzheimer's and dementia. This is pretty significant. Now, the research area, certainly in addition to the NIH advocating for more funding at a federal level, the Alzheimer's Association is also a funder of Alzheimer's and dementia research. And so we provide grants as well, and also looking to diversify the pool of individuals that we fund. And Mary Doyce Ramos is one of the recipients of the Alzheimer's Association research, and really excited that she is doing research specifically on Filipinos. So I look forward to hearing more about her study. You heard Dr. Barriones talk about diversity, equity, inclusion, and we do have a statement about DEI, and you can learn more about our efforts in this space at alz.org/DEI. One of the things that we did was in 2021, we put out a special report called Race, Ethnicity, and Alzheimer's in America. And we surveyed over 2,000 people to understand what are some of the barriers to Alzheimer's care. And this was also the first year that we included Asian Americans and Native Americans in this survey. And what we found is that discrimination is in fact a barrier to Alzheimer's and dementia care. And so you can see here that all of these populations, over a third of all of them, have experienced discrimination when seeking health care. So what do we actually do about that? There's a lot more in that report, but I think for the sake of our time, one of the things I want to highlight is the question around trust. And that is so much related to why we're doing this work, is that when surveyed, do people trust that if and when a cure is available, that it will be shared with them, regardless of race and ethnicity? You can see that all of our populations, less than 70%, feel that that it would be shared with them. And so Asian Americans, 69% said it would be shared, but that means that 30% feel that it would not be shared. I don't know if I messed that up. So I think it's 30%. So 30% of people would feel that it would not be shared with them, right? And that's still pretty significant, and that we need to do some work in making sure that there is trust. So there's that front, and then there's also the area around studies themselves. So when we look at clinical trials and, for example, treatments available, how do we know if they are effective for you and me if we are not represented in the studies? And in fact, that less than 1% of NIH's total budget has gone to research projects focused on Asian Americans and Pacific Islanders. So we certainly have some work to do to build that trust and also ensure that studies are available perhaps in language and also are inclusive of Asian Americans, Native Americans, Latinos, and African Americans for that matter. So the work of the Alzheimer's Association in pursuing health equity, one of the things that's really critical is the workforce. And I'm sure you're all from the PNAA understand this, that there's a growing need for more people in this field. I always hear that there's a demand for nurses, and in particular, PCPs, primary care providers, when asked, is there a need for dementia care specialists, over 55% of them said there is a real shortage of people who are specializing in dementia care. And so this is an area of great need. One of the things that we have done around public policy is listening and understanding what the needs are to build a more equitable space in research, is the advocating for this piece of legislation called ENACT, which stands for Equity in Neuroscience and Alzheimer's Clinical Trials. And what this really was to accomplish is to expand the outreach to underrepresented populations, increase the diversity among clinical trials staff, so making sure that those who are actually conducting the studies are reflective of these communities and understand the communities that they're trying to reach. And then third, to reduce the participation burden. Think about how far do people have to travel to that particular research site, or is there any stipend or whatnot? How are they able to sustain the time that they need to participate in that study? Very pleased to share that key parts of this legislation has been actually integrated into the federal budget this year. So we're very hopeful that that means Alzheimer's disease research centers, as they are receiving money to continue to do this work, that these elements are actually built in to that piece, and so that they're held accountable for making sure they are in fact inclusive in their studies. We also want to educate the community constituents that there are studies available, because that's the other piece, is we hear from communities, well, I was never invited to participate. So it's not a matter of I don't want to, I didn't know that they exist and I was never invited to participate. So Trial Match is a program of the Alzheimer's Association that they can either look it up on our website, or they can call our helpline and answer a few questions. And then what would populate are the studies that they are eligible to participate in. And then it is entirely up to them whether they want to get involved or not. And then one of the, I think, real core programs of the Alzheimer's Association is our helpline. This is a helpline that is staffed by professionals whose sole job is to make sure that they are answering calls and helping families or professionals who are dealing with whether they're concerned about their own memory, or they've just been diagnosed, or they're trying to figure out, how do I plan for the future, or they have a specific situation that they don't know how to handle. And people can call this 800 number 24/7, and it really is open 24/7. Additionally, our goal in this partnership is to make sure that we're connecting Philippine Nurses Association chapters with the Alzheimer's Association chapters. And so if you were to go to our website and look up local resources that's highlighted there, you'll find that we have over 70 chapters across the country. Even American Samoa is represented through our Aloha chapter, Guam as well, Alaska. So if you were to hover over the map, whichever state, and enter a zip code, it would connect you with that chapter. And our hope is that by partnering with the chapter, we can better address some of these issues. So perhaps working together to provide more education about Alzheimer's. And one of the things that we are in need of, because we have staff, but we have limited staff. Some of our chapters may be 3 people or 5, or those who can deliver programs out in the community. It's very limited. And nurses are the most trusted profession. And so is it one of the considerations that we've talked about with PNAA's leadership is, could any of the nurses be willing to be trained to deliver some of this Alzheimer's education? So we're always welcoming volunteers to help as guest speakers or as what we call community educators, or even just to think about locally if there are opportunities perhaps to participate in events in the community to provide more information about Alzheimer's. So here I have an example of a program that was held by the Southeastern Virginia chapter, and I believe one of our colleagues, Douglas Punto, is actually here on the call. He led a terrific program. We do these community forums, which is a way to listen to what the community needs and wants around the topic of Alzheimer's and dementia. This was amazing that we had, I don't know how many, it was like over 60, I believe, people who attended this community forum virtually, but really to hear from them and for them to learn about some of the resources and to understand what might they need to understand Alzheimer's better. And in that chapter, they actually are engaged with the local PNAA chapter already. So that's really exciting for us to understand and hear about. And I just, Dr. Barriones shared this picture, so I just wanted to share some proof that we were in person along with her sister, which was great. And I hope to meet all of you soon at perhaps a regional or some kind of a conference. But that in a snapshot is what the Alzheimer's Association is about. And I know we're going to try and leave some time for questions. So I will stop there.
Yeah. Thank you, Edie, for that wonderful presentation. Hopefully a lot of our participants tonight are curious and would like to be part of Alzheimer's Association as well in terms of being an educator or part of the advocacy group or any other things, research, just like what you mentioned earlier. So I'm one of the recipients for the Alzheimer's Association research grant, which is focused on diversity as well. That's the grant that I got. That's why my research is also focused on Filipino Americans, and some of our actually nurse leaders or chapter presidents and president-elects were part of that research when we did our Camp Aruga in Orlando, Florida last January. And most of them were actually participants of that session, just to build or develop the Care Partner Activation Program for Filipino Americans. So let me also share my slide for our Alzheimer's Association chapters, just to give you an overview of the different chapters that we have for PNAA, and also the dates for our educational offerings for this year. So, yep. So you probably heard Dr. Barriones on her welcome, Dr. Carl Hill, and Edie Yao, which is the Director of Diversity, Equity, and Inclusion. So this is just the program. We're almost done. I'm the person before the Q&A. So this is the website wherein when you go to PNA, so that's mypnaa.org, that's our website, and you will see the message of Dr. Barriones. And as you can see on the right, there's quick links And sorry, I think hang on, give me a. Okay, so for the quick links, you got here regional chapters. And when you go there, you will see the different chapters, the North Central region, Eastern region, Western region, and South Central region. And we have 4 vice presidents, starting from North Central region, Eastern region, Western region, and South Central region. So for the North Central region, we currently have 10 chapters. And if you go explore our website, you will see the details of the president, the information of the president and president-elect, including their contact information in there. So if you would like to connect with them, if you're from a certain chapter of Alzheimer's Association, so you can find their information in here and connect with them. We have a lot of local programs as well from those different chapters. So this is the North Central. So we have Central Ohio, Cincinnati, the Kansas City, St. Louis, Illinois, Indiana, Michigan. We got the Northwest Indiana, Ohio, and Wisconsin. And then for our Eastern region, these are our 10 main chapters, but we also have some sub-chapters, especially in New Jersey area. So we have South Carolina, Maryland, Richmond, Virginia, Virginia chapter, Pennsylvania, New Jersey, Metro DC, New England, New York, and North Carolina. So for Western region, we have Arizona, California, Central California, PNA, Colorado, Hawaii, Maui. Oh, just to plug in, our next regional conference will be in Maui, Hawaii. So this coming April. PNA, Napa Solano, Northern California, Oregon, San Diego, South Riverside, Southern California, and West Los Angeles. And last but not the least, we have the most chapters in South Central region. We have Alabama, Central Florida, Central Texas, Corpus Christi, Georgia, Gulf Coast, Florida, Lubbock, Metro Houston, Miami and Southeast Florida, Nashville, Tennessee, Tampa Bay, which is in Tampa, Tennessee, Texas, Cameron County, Texas Golden Triangle, North Houston, Northeast Florida, North Texas, San Antonio, and South Texas, Rio Grande Valley. So for our educational webinar series, the first webinar will be on March 16 at 9 to 10 p.m. Eastern Time. That will be Understanding Alzheimer's and Dementia. And then the second regional webinar series is from South Central, which will be on June 22nd at 9 to 10:30 p.m. with a topic related to approaching Alzheimer's, first responder training, and dementia conversations, driving, doctor visits, legal and financial planning. For our third webinar, which will be sponsored by North Central Region, that will be on October 6th at 8:30 to 10 p.m. Eastern Time, which is about cognitive screening and testing in a biomarker era, and also healthy living for your brain and body, tips for the latest research. And last, for this year, which is our fourth webinar, sponsored by Eastern Region, that will be on November 30th at 9 to 10 p.m. Eastern Time. And they will talk about understanding and responding to dementia-related behaviors. So the official flyer will be posted soon, including how you're going to sign up for those Zoom webinar series. So we have 4 per region, and then each region will connect it and make sure that some of the representatives from Alzheimer's Association hopefully can attend during that session, targeting those different chapters so they can connect and partner with the local regions. So that's our priority. And our lovely vice presidents are here. So we have Manny Ramos from South Central Region, make a way. Miss Manilita Dayon from North Central Region. I think I saw also Warley, did I saw Warley before? Oh, there it is. Warley Remigio from Eastern Region. So make sure that, you'll be familiar with these faces. They will be our master of ceremonies during those events. I'll be part of the team that will moderate the session, but they will be leading those webinar sessions for each region and making sure that those chapters will be in partnership and in collaboration with different chapters for Alzheimer's Association for a wonderful and fruitful conference. And we hope that this will be a continuing partnership with Alzheimer's Association. So do we have any questions, especially for Edie Yao that we have here? I know we have a lot of folks from Alzheimer's Association as well. So if you have questions, so you can raise your hand or just speak directly. I think there's about 56 of us in the room. So
Mary Joyce,
yep.
if I could just share, I think perhaps one of the questions, at least from our chapters, our Alzheimer's Association chapters might ask, well, what is it that we committed to do together in this partnership? And as Dr. Hill mentioned, it is very much focused on education and raising concern and awareness. So the webinars that you just listed, I think, accomplish that. And so at a local level, as PNAA and Alzheimer's Association chapters get together, I think the goal is, that's just the framework. So whatever you all decide to do together is pretty open. And so hopefully having more of a presence in reaching, again, our Asian American communities, our Filipino communities would be fantastic, because we've not done enough of that. And we would love your guidance and your support in how to do that best. So that, again, families know that they can reach out to us for support.
Yeah, and just like what Edie mentioned too, it always touches our heart, especially for nurses, that we are the trusted profession, for the past decades. And that's a wonderful connection for our families and family caregivers who have similar issues. I know their stories are unique, but some of the issues that family encounter, especially for providing care or some of those doctor visits or some trials available for treatment and things like that, I know they need major education to make sure that they will get the best resources that they can. So let me see if we have questions from the chat box, but for those people, you are welcome to ask questions. So I'm not sure if there's any particular burning questions that you have right now.
Mayor Joyce, there's one from Mary Lou. Do we get contact hours with the education webinars on Alzheimer's?
Some of the sessions will have contact hours. So there are some sessions that are focusing on more of community. Some of the community sessions or community education will not have contact hours, but some sessions that more like scientific and more nurses driven. So those we will have contact hours for those. So
Great.
that's because there are some sessions like double sessions per region. So for example, in South Central, so there are 2 topics, and also North Central region, but only one of the topics that we can have contact hours for those. So, but we will put it in the official flyer for the contact hours, because we still need to apply for those before we get the contact hours. So.
Thank you. I guess I'll just continue being the chat box monitor here. We have a question from Chris Escarilla, PNA San Diego, what was the reason why Medicare does not support the new treatments? Is there work currently underway to support seniors under Medicare to receive the treatment?
Yeah, thank you for that question. I'll answer that first, and if anyone else wants to address that. So in 2021, aducanumab came out as the first FDA-approved treatment for Alzheimer's, and there was a lot of controversy around that one. So there was some thought that it wasn't effective enough, perhaps, and also it was very costly. When FDA approved that, and then Medicare said, well, we will approve it with limitations. And what they said was the entire class of drugs. So what they said was that we'll cover it for those who are in clinical trials. Now, if you're not already in a clinical trial for one of these treatments, it's probably too late to join, right? So that really doesn't apply to everyone. And the other thing is that now that we have lecanemab that's been most recently approved by FDA, it has shown to be more effective than aducanumab in that it slows cognitive decline. That doesn't seem to matter to Medicare. They said it's still part of this class of drugs, and our stance is the same. So we are going to make a big stink about this at Advocacy Forum when we're on at the Capitol, March 20th, around that time, because every extra day, every more time that people can have with their families and their loved ones matters. And so we're really trying to advocate on behalf of families that this is important to them. It is unprecedented. I believe that in all of history, that every time there's been an FDA approved medication, that Medicare says, yes, we will cover it. And in this case, they are not covering it. So we certainly need more people to advocate for this. And I don't remember if there was a second part to that question.
I don't think there was a second part. I do want to acknowledge, it says here Manny Ramos, but that does not look like Manny on the screen, who raised her hand.
It's Pearly.
Oh, is that Pearly? There's
Yeah.
there's a hand raised.
Yeah, it's
Oh,
me.
there's another hand. Sorry, Pearly.
It's me, Dr. Sorry,
Okay. Oh,
Riza.
yeah. It's a little dark. I can't see you, Riza.
I shared my link, so
Oh,
Okay.
yes.
All right.
Thank you, Manny.
Yes, please.
I look
Dr.
like
Maria.
Manny sometimes. Are you calling me or?
Yes, we're calling you.
Pearly.
Yeah.
Okay, yes. Thank you so much, Dr. Celia. I was just curious. I know this is lunch for the Filipino community, but if there are other ethnic community that are interested, particularly the non-healthcare providers, can we allow them to participate?
Yes, we are opening the sessions for everybody. So it's like for nurses and non-nurses. For nurses, just like what I mentioned, because we still need to apply for the contact hours for that. That's the, that's the plan, is to provide contact hours, but it will depend on the content, the exact content of that for ANCC to provide that. But the hope is to also reach out to families and family caregivers of, whether you have, because we probably, all of us now, when you ask, do you know someone with Alzheimer's or dementia? And we know someone, like I have a grandmother who have one, and probably you have similar stories like that. Just like what I said, we have our own unique stories, but we have similar issues or concerns that we might experience, and it will be helpful to reach out, especially to those people that does not know much about it. Just like what Edie mentioned on those trials, it's not just like the people that are hesitant to join the clinical trials, it's just that they don't know that there's a trial going on. So
So may I add, Dr. Doyce, to address Dr. Mauricio? This is diversity, equity, and inclusion, Dr. Mauricio. So yes, it's open for everyone. Please invite them to join this education.
Yeah,
Great.
because what I was thinking that even though you have Filipino community, there are some caregivers that are non-Filipino. And so even though they're caring for perhaps a Filipino patient, but then their caregivers are non-Filipino, so they can still benefit from the webinars that's targeting the non-healthcare providers.
This is the intent. The intent is really to get everybody, and we are a vehicle. PNAA is a venue that's open for the public to be educated.
Great, thank you, Dr. Beriones. Just a little comment here to Gigi Narisma Estabilo. She was asking about the medications. Someone posted the link. Peining Chang posted the link of all those medications that you were asking about. So if you could click that link in the chat box, that should tell us what those medications that are not covered by Medicare. And I just
Yeah.
wanted to make sure we acknowledge the hands up, Pearly, and then I will call Bong Dion next. Pearly, please.
Hi, this is Pearly Aguinaldo from San Diego. I've been in communication with the local Alzheimer's Association San Diego, and I asked, where can we volunteer? What's the best way we can volunteer? And they said, as with us being nurses, is as educators, and they have a formal training for us to be involved into doing this. Is PNAA going to do the same thing? Will there be a conflict? Like, I have an appointment to meet with the program director. I already actually signed up to be a team for the Alzheimer's Walk on October 7. So this is something that way before, when I first started as president, it's in my initiative to get involved with Alzheimer's Association. So we are in communication with the local San Diego Alzheimer's Association. My question is, will PNAA provide the training for us to volunteer as educators, or do we go by our local? I mean, the more the better.
Our intent, because of our partnership, we start with, because this is very new as our partnership, so our focus for now is educational awareness. But at the same time, we our main goal is actually to partner with those chapters, so you can communicate directly with those local chapters, making sure that local chapters are aware that there's a PNA chapter in their area. And then once you communicate, I'm also one of the community educator for Alzheimer's Association, and I connected with PNA Georgia locally, and then I did the training and stuff online. They do background checks. It's really someone mentioned it in the chat, like someone from Texas actually started after I delivered some of the content for Alzheimer's during the Camp Aruga session, and then they reached out to Alzheimer's Association chapter in Houston, and now that person is clear for her background check, and she's, I think, about to start her training to educate the community. So that's the intent, is to empower those chapters, because you are the ones really like front and reaching out to those communities and making sure that the local areas that you are in, we will be catering those people in that area. So we cannot say that we will not do that. Just like what I said, it's a continuous partnership that we will be planning to do, and we'll strategize probably with Dr. Beriones' guidance, and then eventually Dr. Marlon Saria, who can probably answer that if we will have future official training. Because I remember other partners like the Black Nurses Association and Hispanic Nurses Association, they train the nurse leaders for brain, can't even remember the whole name of but they train nurse leaders for that specific group. So we might use that same structure for our organization because they found it really successful for making sure that, whatever we're doing, we're focusing on health equity and also community awareness and education. So.
Great. Thank you, Mary Joyce. And I just wanted to mention we do have a lot of comments here in the chat boxes. Local chapters of the Alzheimer's Associations already networking with the local chapters of PNAA. So it is happening. Maybe I could ask Mary Joyce or our Zoom master, maybe we should start calling her Zoom doctor now, Carol Robles, to get all these contact information and send it out to everyone who attended today, just in case someone doesn't have access to the chat boxes, but those connections are being made right now. I have 3 hands, and maybe that will be it looking at the time. So Bong, Dr. Jurado, and Dr. Remigio, and then we will probably close the event, since many of us have other meetings to go to after this.
Yeah, hello, good evening. Oops, unmute.
You're
Okay, am I unmuted? Okay.
yes, I can hear you.
All right, there you go. Good evening, everyone. And I just found out that we have a Alzheimer's Association in Greater Indiana, and that's where I live, in Merrillville. So my question is, because I want to prepare ahead, aside from working with you and Dr. Mary Joyce, can I also contact these people or this chapter to work with me? So when we have our presentation, I will just tell them, and then they can help me with the presentation. This is in Northwest Indiana chapter. Can I collaborate
Mary,
with them?
Mary
So
Joyce,
to
if I
start-
could answer
Yeah.
that, yes, please, by all means, you can reach out to your chapter. I am also happy to help do a warm introduction, just because I want to make sure you get connected to the right person. And so I'll put my email address in the chat, and that way make sure you're connected to the right person. Because sometimes if you go just to the generic email, I just want to make sure that you're connected with the contact. So I would say that for all of you, you can certainly go to our website and connect that way. You can call our helpline as well to connect. We have internally informed the association, the staff, and the chapters of our partnership. However, sometimes people aren't always caught up with all of the news. And so I just want to make sure that we make sure we're connecting the right people. And I do want to just acknowledge we have a number of our colleagues here. I'm probably going to miss some, but again, I want to mention Douglas Panto here from Southeastern Virginia chapter. He's waving his hand. We have Pei-Ning Chang here from Northern California, Northern Nevada chapter. We have Linda Loera, who's from the California Southland chapter, and Janet Hamada and Lena Huang from San Diego chapter. Also Sabrina Strawn, who's from Houston. So, and if I've missed anyone, please go ahead and put your name in the chat and say hello.
Thank you.
Thanks, Edie. Dr. Jurado and Dr. Remigio.
Dr. Remigio would like to go ahead.
Okay.
Thank you, Dr. Jurado. It's more of a comment, and again, our deepest appreciation for extending the partnership to PNAA and to its local chapter. This is very timely because I know that this is one of the identified needs with our communities, especially with the Filipino American community. And I think a great structure too, if I may, is using our NIANs. I know a lot of the chapters of PNAA have established a strong relationship with faith-based organizations, with grassroots communities like us in New York. We want to use the vehicle, and now in partnership with our local Alzheimer's Association, in terms of spreading the word and really be the ambassadors of Alzheimer's. So thank you so much for the opportunity. I just wanted to ask that you, Ms. Yao, if, let's say, since we have built this partnership and we have built great resources, a lot of faith-based leaders who wanted to join in and be part of maybe the education team, would that be something that you're interested? They may not be nurses, but I know some of our members are teachers and really respected members of the community.
The more the merrier. We would be delighted. Yes, let's definitely talk about that some more.
Thank you so much.
Great, thank you. Dr. Jurado, last question for the day.
Yeah, so I'm loving the vibes here, the energy. It's so good to see everyone responding to each other, and that's basically the idea why we are doing this in partnership with the Alzheimer's Association. I guess there are many questions with regards to the many initiatives in every chapter. Maybe one of the things that Mary Joyce, Dr. Ramos will be doing, as she is the coordinator of this program with the PNAA, is to get summarize all those participation in every chapter, and so we could see the outcome of PNAA and its chapters with this program. One of the things that we thought when we were trying to put this together with the Alzheimer's Foundation through Edie here is we thought of maybe even bringing this to our international conference to the Philippines. Oftentimes, we are so concerned with cancer, with heart disease and all the big diseases, but we never thought about Alzheimer's. We don't think about Alzheimer's disease impacting our lives, but it is so much so that I would say that most of us are impacted with Alzheimer's. Sometimes, increasing that awareness, particularly our fellow men in the Philippines, that sometimes we think about Alzheimer's as a part of life, but it's not. We think about ulianin, forgetful. It's just a part of life as we age, but it's not. So I'm hoping that this program will grow. I can see it now that it's growing. So I'm excited to move on and continue this partnership. And thank you, Edie, for partnering with us with our regional programs already, starting in Hawaii. And I see that you'll be with us with our Alzheimer's Association will be with us with the Cruise Convention, sponsoring us with that program. So thank you so much. And I just want to thank all those people who attended today and all those chapters of Alzheimer's Association already associated with our PNAA chapters. Thank you.
Great, thank you. On that note, I'll just take it from here, Dr. Mary Joyce Ramos, since you had me as the closer. I think the most important job for today is to thank the people who made this happen, who made this evening happen. So we really would like to thank Dr. Mary Joyce Ramos and Edie Yao from PNAA and the Alzheimer's Association for getting all of us together tonight. Dr. Gloria Beriones, President for PNAA, Dr. Leo Felix Jurado, our Executive Director, and Dr. Carl Hill, the Chief DEI Officer for Alzheimer's Association. I also wanted to share with all of you and our partners from the local chapters of the Alzheimer's Associations that Dr. Carl Hill will be speaking at our Western Regional Conference in Maui, Hawaii. That's why I'm wearing this Hawaiian shirt, to make sure say that. Maui, Hawaii, April 20 to 23. You will find the information on the PNAA website if you want to see Dr. Carl Hill in person with PNAA. I was in DC and I was visiting the National Museum of African American History and Culture, and I saw this quote, and I wanted to share this with you. For centuries, African Americans have formed associations for mutual benefit and advancement. While many Black organizations emerged in response to segregation, they also promoted cultural values of community, education, and service. Membership provided opportunities to develop leadership skills, pool resources, and cultivate a sense of pride and belonging. As African Americans organized for success, they created ways to help themselves and build powerful networks that could be mobilized to work for social change. And I think that is what we are doing here tonight, creating and building powerful networks that could be mobilized to work for social change. It is an important work. It is huge work, a work that no one organization can do alone. And that's why we're partnering PNAA and the Alzheimer's Association. And I will leave you with this quote from the book, The Boy, the Mole, the Fox, and the Horse by Charlie Mackesy. "We have such a long way to go," sighed the boy. "Yes, but look how far we've come," said the horse. "We've come a long way, guys." Thank you for your attendance tonight, and we hope to see you at all other PNAA and Alzheimer's Association events. Good night, everyone.
Good night.
Thank you. Thanks,
Thank you.
everyone.
Thank you, Dr. Saria.
Aren't you gonna take a photo?
Yes, yes. Hold on, hold on.
Zoom
Don't
doctor.
leave yet,
Don't
everyone.
leave, don't leave. Open, everyone.
Okay, let's see.
Carol, get busy.
I know. Okay, let's see. Manny, can you take the screenshot? My tab is not working.
Oh, okay. Sure.
I'm frozen, Carol.
Okay, I'll do
Yeah.
it. Let me make sure I
Those
capture
who
that.
are not showing their faces, turn it on, please.
Yeah.
We can see you.
I'm unable to do my camera, sorry.
It's
Trying.
okay.
Okay, let me take more photos. All right, I'm gonna go to page 2.
Mean page.
Paste. And then I'm gonna go to
All pages.
page. Oh, there's only 2 pages.
Oh, no.
All right, those who wants to open their camera, go ahead and open more, and then I'll take more photos.
Grandpa Pete is trying to prepare.
I'm
for
giving
his
you 30
Alzheimer's.
seconds to take open your camera.
Maria Sagon, open your beautiful face.
She can't. She's
All right,
unable.
hold on. I'll take another screenshot.
Something wrong with her computer, she said.
All right.
Apologies, my camera stopped working.
Just keep
Uh-oh.
smiling without the camera.
I know I am. Believe me, I am. If you can see me, I'm smiling.
All right, let
You
me
always
take
are.
another photo. Here we go.
Hey, Lizelle.
Hey, Manny,
Good to
it's
see you.
Gigi. Make sure
Yes.
I'm there, Manny. I'm driving.
Oh, okay.
Make sure I'm there. I'm checking that.
Oh, there you go.
All right.
Oh,
Thanks.
there you go. Great to see you, Maria.
Back.
Okay, we got it. I'll send the photo.